this presentation of State Broadcasting Corporation.
Hello and welcome to Community Link. I'm Yvonne Castillo. I have as my guest today Solange Marcel, an adult nurse practitioner with the New Direction Unit of Dodge County Hospital. Did I get all of that right?
You did, Ms. Solange.
It's so good to have you with us today because you have some wonderful information to share with us. First of all, you have an educational series going on. One of the sessions has finished. I think it ended in June, but you have two more coming up. Tell me about those.
We do. We have the next one, which is actually next Thursday, July 28th from 6 to 7:30 p.m. And that's going to be focusing on caregiving for the dementia population. And then following is going to be August 25th, and we're going to actually have the Alzheimer's Association presenting.
Now, the New Direction Unit is not brand new, but it hasn't been there years and years. Tell me about the unit and when it was added and exactly what's the scope of its services.
Okay. It actually opened this October will be 2 years ago. And New Directions is a geriatric psychiatry unit at Dodge County Hospital in Eastman, Georgia. And what we do is we focus on the assessment and management of older adults, typically 55 and older, who suffer from either late onset mood disorders, that may be depression or anxiety, and then as well as dementia, the different types of dementia.
And one of the challenges is to be able to determine exactly what's going on when you talk about the elderly population. Is that right?
It is, definitely, because you cannot assess an elderly person the same as you would someone that's a younger adult or even a child. And as someone ages and they have different cognition impairments, they're not going to present the same way that, let's say, someone who is depressed presents when they're younger. So we have to take a very holistic approach when we're assessing a person.
The New Direction Unit, how do people come to get the services of that unit?
Right, that's a good question. Typically, we have patients from the community, which may be referred by their primary care provider. We can be called directly. We have had family members call us directly. And then as well, we have a lot of referrals from different skilled nursing facilities, assisted living facilities, and different hospitals, particularly Fairview Park Hospital we have a very good relationship with them, and then the Lawrence County Community Mental Health. So there's a different array of referral sources.
Without having firsthand knowledge, often people may not fully understand the various illnesses that you're dealing with in this unit, and specifically for a certain age group. Give me a little bit more information about all the various ailments that you probably have to deal with, and some of the things that you do at the facility to try to alleviate the suffering from it.
Well, kind of going back to what I mentioned briefly, that we look at dementia in the older population and maybe bipolar, maybe schizophrenia. There is more depression. I just want to kind of say this. There is more depression as people age than is recognized, because we assume that obviously when you live longer, you're going to experience losses. It could be an individual loss of a family member. It could be loss of independence, loss of being able to drive. And I think as the community, just assume that people are supposed to accept this and move on. But what happens is people start to isolate. They start becoming depressed, a lot of times secondary to losses. And so when a person comes to New Directions, we're looking at what is going on, not just psychologically, but very importantly, socially in their environment. And so we do group therapy, we do individual individual therapy, we do medication management, and we